The Oncology Care Model put out by CMMI through CMS is a step forward in starting to think about value. Now, it is the first step. So this is not going to be transformative. We're not measuring overall survival, progression-free survival, time to best response. We're not measuring incidence and severity of toxicities. We're not looking at, did the drugs cure people or not cure people? We're looking at something in between. Did you avoid unnecessary ER visits? Did you avoid unnecessary hospitalizations? Did you offer patients at the end of life access to palliative care instead of continued chemotherapy? So really, this is the first step to aligning the entire nation towards a path of value. So I personally believe there'll be some savings, not substantially, and I really don't think we're going to change true hard quality outcomes. Maybe a little, but not a lot. I mean, no one wants to go to an emergency room if they don't need it. And if you have an alternative of going to your doctor's office because they're open later, and you have a care coordinator that gets you in to see the doctor sooner, so that if you're nauseous, you don't wind up dehydrated and in kidney failure, but in fact you get an IV. Those are all good things, but that's kind of snipping around the edges. It doesn't go to the core of cancer's complex, the therapies are complex, the application of getting to the therapies is very variable. How do we drive out that unnecessary variance?